Hello, we're here in the Sri Narayani Hospital and Research Center, and we're in the office with Dr. Vijaya. She will tell us, she's a neurosurgeon, and she's going to tell us first about her project, Women in Neurosurgery India, and then we'll hear about her daily practice, as well as some of the outreach practices.
Yes.
Okay.
Thank you very much for your great support. I know you've been supporting us a lot in this hospital. I've heard a lot about it. Okay. WINSI, Women in Neurosurgery, in our NSI, Neurosurgical Society, is a very small group of 75 people, women in neurosurgeons. About 40 of us all qualified, around 35 still qualifying. We are trying to have a forum for ourselves in this male-dominated society. So that is it. It is nearly 30 years since I qualified as a neurosurgeon. This is the first time we are having a forum. 2 years from. Okay. The first woman neurosurgeon in Asia. She's now 86 years old. Dr. T.S. Kanaka. She's in Chennai. She's retired as a professor of neurosurgery, and she's now running a geriatric research center catering for old people. She's looking after them, their day-to-day problems and everything. So that is how I got my inspiration from her to become a neurosurgeon. This is WINSI in a nutshell. Here in Sri Narayani Hospital, we've been doing a lot of outreach programs. We go to certain small towns and conduct camps, on specialized camps. As a neurosurgeon, I'm interested in epilepsy, I'm interested in head injuries, stroke, and any person with low back pain, spinal problems. So we have been conducting camps in such places. Then we found that it is better to have a free camp in the campus itself regularly every 3 months. We have an epilepsy camp where people are invited. We have a list of these people. We send letters to them. We call them by phone, tell them it's so-and-so day, we are having a free camp. Please do come and join us. It is because when all of them come together, we find that they interact among themselves, tell each other how they are. I came 3 years ago. I started taking medications properly. I've been told about how to take the medicine. I'm writing a diary, so I'm all right. So why don't you do it? Like this, they interact and exchange their own best moments with others. That is what we want more than anything else. And then I see them, and my colleagues see them. We prescribe medications accordingly, and they go home with a little bit of free medicines also. They're very happy, because epilepsy in our country, in our part of the country, everywhere I saw that, it's something like a social stigma. Okay? A person who has an epilepsy is visited by the demons. Okay?
Do you find that the peer group, kind of that support network, works towards kind of de-demonizing?
Yes. There are people in the villages, like you hear it even in UK. They talk about witches. Certain ladies, they are branded as so-and-so. Similarly, here also the village elders, they think that I've been seeing epilepsy for such a long time. This is a visitation from the God. It cannot be treated. No medication is going to give you any relief. You are going to be a paralyzed person. it becomes a social problem for the family as well as the child or the adult male or the female. And then the next stage, whether to get them married. If married, then what do we do? Whether the child is going to be the same. So many questions to be answered.
How do you identify the epileptics in the community? Because typically if it's a disease that, or condition that's looked upon illy, that it's difficult to identify the people in the community, because it's like any mental health illness, they, suppress it and they don't talk about it. So what kind of network is there so that you can find out who those people are, so that you can reach out?
In this reach out, I've been using my own patients.
Oh, okay.
There are some teachers, the headmasters. They go talk to their students, they tell them, this is what it is.
Oh, that is a brilliant model.
That makes a lot of difference.
Yes.
Rather than a lady or a male nurse going to the hospital, town and saying that we have come to see whether there are any epileptic patients. Everybody goes inside and locks themselves.
So a peer group environment.
Peer group. That is the most important thing. She has water. Okay. No. That is it.
That's probably the greatest success of the program. Is they're hearing it from their friends, their sisters, their brothers, their neighbor, as opposed to a stranger going out into that environment.
I get patients from far away because somebody else told them that I become a better person with these medicines. Please go and see them. Okay.
Wow.
It just needs a little bit of understanding from the doctor, not as a doctor, but as a human being, to listen to them, find out what kind of an epilepsy they have. There is a different variety of epilepsy, from momentary unconsciousness to severe tonic-clonic seizures.
Right.
There are a gamut of...
Is there anyone out in those communities that, from a medical standpoint, once you've reached out to those groups, is there people in the medical community that you can count on to help the epileptic community?
Yes, we do.
Okay.
So we do ask them to help. The local doctors.
Because you couldn't possibly manage the entire network.
What we do is we give them a notebook. Okay, in which we ask them to write a diary. I take this medicine at this particular time, at a particular day.
Right.
If it is morning and evening, please write the time. And the day you have a seizure, please write there, particular time and the seizure, what you had. This you show it to your local doctor. Okay, the local doctor understands that somebody else is giving them a medication and I have to continue and counsel them.
Oh, that's okay. That's
so
a very,
that notebook
that's a very
makes
community-based
community-based
medicine that's kind of initiated in the health center and then spread out.
And then it spreads out.
Yeah.
So it makes a lot of difference. This, to tell you the story, how I started it, in a clinic like this, about 22 years ago, a young girl, 18-year-old girl, was brought by the father to me as a seizure. I said she has to be on medication. This is the medicine which we have to give her. She has to take it daily. Everything I counsel. Mm-hmm. The father, it is from a place near Madurai. Very, very chauvinistic people, men. Okay. Not only that, that is where the female infanticide is very common. They killed as female fetuses. Okay, it used to be a common thing in those days. So the father asked me, this 18-year-old girl, I'm going to get her married. How can I give her medicines? Because if I give medicines to her, if she goes to her in-laws' place, they'll say that she is on medicine, she has got a mental problem. They will not accept her.
Yes.
So I had to spend 1 hour talking to him, talking to the daughter, everything. And she took the medicine for 1 month. 1 month only he bought the medicine. Next month he refused to buy the medicine and then brought it 2 months later in a very bad state. This time he tells me, if she has to be on medicines for lifelong like this, let her die.
Wow, how did you feel?
How do you
That
feel?
was just,
I never saw that patient again. It sort of made a lot of impression on me.
yes.
I felt very sad that this can happen like this. Okay. Then it started. I started doing this, and there's tremendous, interest in that. The same area people used to come. One girl will recommend her own cousin to come. So it kept on coming. They did it well. So
It's just getting that support in the community.
this outreach has helped people. So that's what I feel
There's
very
so
happy
much
about.
strength in numbers,
Yes.
right? If you put a number of epileptics together and they start telling their story, and then those loved ones see that person,
Yes.
and they know that they're a beautiful person, and then it just, that has potential. That has potential to grow. That's when I look at that from the programs that we have in Canada, I think you're doing a much better job than we are.
No. I wouldn't say.
You know,
Every
as far
one of
as-
you are doing something great.
But it's one of Canada's biggest directives is to take healthcare out into the community. But Canada would have put so many barriers in front of what you did. There would have been this regulation, or you have to go see this health authority, or you have to go see this network. Whereas you were able to get it out into the community just simply for the purpose of what it was for, right? Is to increase awareness and to have better care for the patients.
Yeah.
So no, wow, I commend you on that work. That's a brilliant program.
At least Tamil Nadu has got a very good network of roads and such things. We can reach people.
Okay.
Whereas I worked for 3.5 years in Assam. People used to come from Arunachal Pradesh to the place where I was having the clinic. They have to cross Brahmaputra river and come.
Yeah.
It's the travel itself is a huge problem for them.
Right.
And then to get the medicine, where will they get it? Their
Yes.
pharmacy doesn't have this medicine. Simple medicine, but they don't have it. I can only supply them with 3 months of medicines.
Right.
So we just taught the representatives who are from the particular companies, please ring up these people and find out whether they are continuing medication or they're able to get it. If not, please supply them there.
Wow.
So
yeah.
they started doing that.
Really.
Small amount.
Yes.
It was not big, this thing.
And a
Small
lot of-
amount of help we could do that. That is it.
And a lot of times it's not it's readily available medicine, and it's not an expensive medicine.
It's not very expensive.
Right, but it's actually just the distribution of the medicine that's the challenge. Yeah, wow. That's an exciting
Arunachal
program.
Pradesh is as remote as your what is that IC Calgary. Beyond Calgary, you have a big IC plateau, no? Where you it is not reachable during the summertime, but during winter you
Then
can drive over it. I have read about that. You're saying
Yeah, that's
Wow.
up north.
Yeah, they
I
have
think
ice
that-
roads.
Ice road,
Yeah, that is a very good analogy.
Very,
I
very.
mean, you have literally ice roads as far as distribution.
And you have to drive across the frozen lakes to get to the next town.
no.
So
that
where
is
do
that
you
is one
think
thing.
the program will go?
This program,
Yeah.
I will keep on running it.
Yeah.